Hi, I'm Dr. Achal Pant and today I'm going to tell you how you can manage your acne at home. At the end of the video, I'll tell you all the things that you should absolutely not do which can cause more harm than good. Before I begin, I have to tell you that acne is a chronic condition and you should treat it as such. Okay, don't look at acne as just this one lesion that you need to take care of right now. Okay, that way you will not be able to prevent new lesions or you'll be able to prevent scarring. Remember that acne lesions can be of various types such as just papules, pustules, cysts, nodules, or even multiple whiteheads. Okay, so if you have such lesions, you have to consult your dermatologist, take proper guidance and treatment in order to control it. So why am I making this video? I'm just making this video to educate you regarding certain ingredients that you can incorporate in your skincare routine if you have acne prone skin. Okay, but if you have a full-fledged acne, you must visit a dermatologist. So what is acne? Acne is a chronic condition of the pilosebaceous unit, okay, which means that there is a hair follicle on your face and there's a gland, the oil forming gland next to it. So when there is an inflammation of this area, it leads to acne. So there are four causes for acne. First is increased oil production, second is bacterial infection, third is thickening of this lining, and fourth is inflammation that occurs because of all the three previous processes. Okay, so this is what leads to acne. So applying creams may or may not control acne. You might need to be on oral medications, but in this video I'll give you some safe alternative that you can use in order to control your acne. But remember, this is not a substitute for a dermat visit. When can you treat acne at home? First, if you have very mild acne and very few lesions, so let's say if you develop only 1 or 2 acne in a month and that subsides in a week or so, then you can use certain creams to treat it at home. Second is that if you have no personal or family history of post-acne scarring. And third is when you don't have any history of cysts or nodules. So when you have very mild acne without scarring or cysts or nodules, then you can think of managing it at home. So what are a few things that you can do at home to manage your acne? So remember that acne is a chronic condition and that needs to be treated properly. I'm not trying to scare you, but it feels terrible when I see these young girls and boys, walk into my clinic with this terrible scarring that could have absolutely been prevented. Okay, and that should be prevented. So please take your acne seriously. Especially if you have a lot of scarring or have family history of scarring, then you have to take a proper course of the treatment in order to see results and use creams for a long time so that you don't have the acne coming back. Okay, so if you only have very mild acne, then there are certain things that you can do at home. So let's start. So what is the first thing that you can do? First is you can apply a hydrocolloid patch. So there are a few brands which make this good hydrocolloid patch, such as Dr. Belluair and this Derma Angel. So what are these patches? So when applied on a pustule, it helps in healing the skin. Okay, so hydrocolloid is like loaded with silicone, which helps in healing the skin. So whenever there is acne, there is a breach in the barrier of the skin, so the epidermis is not at its best. So this hydrocolloid patch will help in soothing the skin and healing the skin so that the epidermis can form again and the inflammation subsides. Okay, so this can be used on 1 or 2 lesions. So remember, if you have a lot of acne on your face, you cannot go and apply this patch everywhere. It's not going to work. If you have this one lesion that is just about to pop or is looking very red or feels tender, then you can apply this over that area to help in early reduction. So second is you can apply a salicylic acid gel. You can apply salicylic acid 1% or 2% gel. I would suggest starting with 1%. You can apply it only on the acne area at night and wash it off in the morning. If you have very sensitive skin, then you can apply salicylic acid for just 1 or 2 hours and wash it off and apply a moisturizer and then go to bed. You can use 2% salicylic acid once your skin tolerates, or you have very thick, oily, acne-prone skin, then you can start with even 2% salicylic acid. Brands which have good salicylic acid 2% are Minimalist Salicylic Acid 2% and Dermaco Salicylic Acid 2%. Ingredient is benzoyl peroxide. Benzoyl peroxide is an antibacterial but does not cause any resistance. I'll tell you what all ingredients you should absolutely avoid, okay, later in the video. So benzoyl peroxide is something that you can incorporate as a gel or a face wash. I prefer as a face wash, which is better tolerated. So you can use this face wash, apply it on your whole face, leave it on for about 2 to 3 minutes, let the active ingredients work, and then you can wash it off. This way, if you have pustules and papules, it tends to get much better. Few brands with good benzoyl peroxide washes are Lyrosol and Brevoxil creamy wash. Azelaic acid is really underrated when it comes to controlling acne. Azelaic acid helps in reducing the inflammation of acne and also reduces the thickening of the lining of the pilosebaceous gland. It also helps in reducing the dark spots that occur after acne. So all in all, it's a really good ingredient. It comes in 10% and 20% concentration. I would suggest you starting with 10%, okay, and if you have a very oily acne prone skin and thick skin, then you can go for 20%. This can be applied twice in a day. In the morning you can apply it after your face wash, before your moisturizer or your sunscreen, and at night you can apply it before your moisturizer, okay. So make azelaic acid the first layer on your skin. So a few brands which make good azelaic acid are Aziclair by Minimalist and Aziderm. The fifth ingredient is niacinamide. So niacinamide is all the rage right now, but it is a good ingredient in controlling acne. Okay, so especially if you have red lesions, red papules, it helps in reducing the inflammation and also restoring the barrier. Okay, so if you have acne prone skin but which is dry, and you know sometimes you have acne prone skin but you're not able to tolerate ingredients such as azelaic acid or a retinol or a salicylic acid or a benzoyl peroxide, then niacinamide is a good option. So niacinamide helps in reducing inflammation as well as reducing the dark spots that can occur after the resolution of acne. So it's a good ingredient. You can start with 5% niacinamide twice in a day. If you're able to tolerate, then you can even use 10% niacinamide. I would not recommend using anything above 10% because it does not have any additional benefits but can actually cause more irritation, so it's not worth it. So stick to 5 to 10% niacinamide. This can be applied twice in a day. If you're using azelaic acid and niacinamide together, you can use the azelaic acid first and the niacinamide on top. So few brands which make good niacinamide are Minimalist niacinamide with zinc and Tivenka gel. So these are the 5 ingredients that you can safely use, albeit carefully, at home in order to control your mild acne. So retinoids are an amazing group of ingredients that have a very strong anti-acne action, but I would suggest you to use retinoids only with a doctor's prescription. Okay, it is a very specific way of using retinoids. It has to be used in a small quantity for a short period of time, and also there are many types of retinoids such as tretinoin, adapalene. So we need to assess your skin and tell you what would suit you best. So always use a retinoid only with a prescription. A detailed video on tretinoin. So if your dermat has prescribed tretinoin, I would highly recommend watching this video because it will give you a lot of information regarding how to use and what you can expect, and also what are precautions you need to take while you're on tretinoin. One more ingredient that I don't recommend you trying at home is antibacterial. So either a clindamycin or a natifloxacin should absolutely not be used without a doctor's prescription. Okay, so these are antibacterial agents. So that means that it kills the bacteria, the P. acnes or the Cutibacterium acnes bacteria that is causing acne. But if you use this unsupervised for a long time, then this bacteria can develop resistance to it. Means that it is not going to be effective anymore. It is not going to kill the bacteria anymore. It's not a scenario you want to be a part of, because then your acne becomes very difficult to treat. So please do not use these creams that contain an antibacterial like a clindamycin or a natifloxacin without consulting your dermatologist. What are a few dietary changes that you can make at home in order to reduce acne? So there are 2 things that have been scientifically proven to exacerbate acne. One is sugar and the other is milk products. Okay, so you want to avoid sugar or any kind of food that increases your glycemic index, meaning that any kind of fast food or food that is very rich in carbohydrate that can shoot up your blood sugar levels, that is something you want to avoid if you are having active acne. Okay, so that is also one of the reasons why you tend to develop acne before an important event. So whenever we are stressed, we tend to reach out for food that is rich in sugar or carbohydrate, that is more soothing. Okay, so that is one of the reasons why you tend to get a lot of acne before an event. So please try to avoid any kind of sugar or high carbohydrate food before any event, or if you have a lot of acne. The second thing is dairy products. It has been shown in a few studies that consuming milk, especially skimmed milk, can lead to a lot of eruptions of acne. Okay, so processed milk is okay. So if you're taking a little bit of butter, cheese, ghee or paneer, that is fine, but try to cut down on milk and buttermilk because that can tend to exacerbate acne. Milk tends to increase the insulin-like growth factors in our body. This insulin-like growth factor stimulates this gland, the oil forming gland, to make more oil. Okay, so that is one of the reasons why you tend to get a lot of acne. So milk products are something you want to avoid. Now I'll move on to some home remedies or some so-called hacks that should absolutely not be doing if you have acne. The first and the most common one is toothpaste. Applying any kind of baking soda or toothpaste on your skin is a recipe for disaster, okay? These toothpaste and baking soda contain base, which is very strong, and they tend to cause a burn on the skin, okay? That can actually cause a superficial burn and leave a scar on the skin, which is something we don't want. So please, no baking soda and no toothpaste on your acne. I've also seen people apply lemon on their skin, which is an absolute no-no, especially in our skin type. It tends to react very easily, and when we apply lemon and go out in the sun, our skin becomes very sensitive to the effects of the sun, okay? That can lead to worsening of tanning or sometimes even burns. So lemon should absolutely not be applied on the skin. And I've also seen some YouTube videos where they propagate using aspirin tablets on the skin. Aspirin is a salicylate and it acts as salicylic acid, and it might help in reducing the eruption, but please do not use this on your skin, because as aspirin, if not properly dissolved either in water or in rose water or any kind of a gel formulation, can actually lead to burns on the skin, okay? So the granules can irritate the skin and superficially burn the skin, and that is something you don't want, okay? So please don't use any aspirin tablets on your face. So what can you do? So now I'm going to tell you some things that you can do at home. So you can apply a little bit of honey. Honey has an anti-inflammatory property, also has a mild antibacterial property. So you can apply a little bit of organic honey on your acne. That is not very harmful. So that can be done maybe once or twice in a week. You can also use rose water. Rose water is an astringent which does not irritate the skin. So it can actually help in reducing the inflammation and calming your skin down, and also reduces the redness. The third ingredient you can use is green tea. Green tea is also anti-inflammatory. So if you have a lot of redness on your face, it can help in reducing it. So you can use green tea bags. You can apply that on your skin, or you can just use cold green tea and just apply it on your face. Leave it on for about 5 to 10 minutes. It has a very cooling, soothing effect to the skin. You can also apply curd. Curd has lactic acid and is also anti-inflammatory, also moisturizes the skin. So you can apply a little bit of curd on your whole face, leave it on for 5 to 10 minutes and wash it off. Making a upton pack or a gram flour pack is also very popular, but do this only if you have very oily acne prone skin, okay? If you have thick oily acne prone skin, that is the skin that can tolerate this. So you can mix gram flour with curd, rose water, add a little bit of honey and turmeric to it, and you can make a paste and apply it on your face and leave it on for about 15-20 minutes. Wash it off and make sure you apply a thick layer of moisturizer after this. I would not recommend using this if you have sensitive skin, acne skin which is dry. Then this is not going to suit you. It might actually irritate your skin and make it appear more red, okay? So you can avoid this if you have very sensitive acne prone skin. So there you go. I've told a few things that you can do at home to manage your acne, but I want to reiterate that this is not a substitute for a visit to a dermatologist clinic. Examining a skin properly and giving a customized treatment, there is no substitute to that, okay? But these are certain things that you can do at home to manage your acne. So I hope you found this video useful. If you like such skin and hair related content, then do follow me on my Instagram handle, Dr. Achal MD. I post such skin and hair related content daily. Thank you for watching.